I'm Alice Park, and I'm joined by 2020 TIME100 honoree and Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros, welcome to TIME100 Talks.
Thank you, Alice. Thank you for having me.
So TIME100 celebrates influence, and you and the WHO have clearly had a major impact on the world this year as we faced COVID-19. Looking back over the year, where would you say the WHO has had the biggest influence in addressing the pandemic?
Yeah, thank you. Thank you so much, Alice. Not only during the pandemic, by the way, even before the pandemic, we have been saying to the world that a matter of pandemic is not if, but it's when. And we have been asking the world to prepare, but not only WHO, lead experts have been saying the same thing. And it was actually a few months before COVID pandemics that we redesigned our structure, and we had a division for emergency preparedness and response, and also a science division and the first ever chief scientist in order to fight pandemics in a better way. As soon as we had the report from China, that's in December 31, we verified this new virus, the report of the new virus, and then we communicated with the world. And ever since then, we have been working hard to help countries. And the first probably major step was on January 30th, when we declared the global emergency, the highest level of global emergency, which we call FIC, so that countries can prepare, because we knew by January 30 that this could have serious global implications. And during that time, by the way, in the rest of the world outside China, there were only about 100 cases, less than 100 cases actually, and no death.
Was there a point at which you realized, I know that you've overseen quite a few emerging infectious disease outbreaks, but was there a point at which you realized that this was no ordinary outbreak, that this would have the global economic, social implications that it has?
Yeah. You know, at the end of January, I had a chance to visit China. That was January 28, I think that around that time, between January 26 and 28. And we had the first-hand briefing while we were in China about how the situation was in Wuhan. And we were really concerned, still being in China, understanding what was going on. I think around that visit, we knew that this thing was very serious. And if you remember, we were using languages at that time saying, this virus is dangerous. This virus is going to be a global problem. And even a couple of weeks after that, around February 11, we even have been saying, this virus is public enemy number one for the world, and that the world should take it seriously. And we were using language, even saying, wake up, asking the world to wake up. This is in early February, after the global emergency was declared by WHO. So from the start, we knew it was serious, it was dangerous, it was public enemy number one.
And some people have said, however, that the WHO waited too long to declare COVID-19 a pandemic. As you said, you've declared it an emergency of public health concern, but it wasn't until middle March, that you declared COVID-19 a pandemic, when some experts are saying all the signs were there. How do you respond to that?
Based on the international health regulation, that's actually what we have, the guidance. The highest level of emergency is actually declaring FIC. So we did it on January 30. What we did in March was a description of the situation. We actually don't declare pandemic. It's not even in the international health regulation. but we declared the highest level of emergency January 30th, and we described it as pandemic in March. And during that time, we even expressed our concern, the inaction of the world, and that many countries were not actually doing what they should have done. And that was when we were worried, and the situation was really spreading, and we just described it. But for the world to really take it seriously, the highest level of declaration was the January 30th, based on the international health regulation.
So part of the challenge of an emerging outbreak like COVID-19 is really managing the unknowns. And very early on, the WHO said there was little evidence for person-to-person spread, which turned out not to be true. And then for a long time, the WHO stood firm that healthy people should not be wearing face masks so that they could be saved for healthcare professionals. And then in June, that was changed, and now we all know that we should be wearing face masks anyone should be wearing face masks when we got in public. Also in June, there was the issue over the asymptomatic spread and the question of, how common or rare that was, when one of the WHO officials had to sort of clear up a misunderstanding that, asymptomatic spread was very rare, was her initial statement. People around the world really look to the WHO for reliable and accurate information during a pandemic. Can you just give us a little insight into how these reversals happened? And what do you tell people now who find it hard to trust or rely on advice coming from the WHO?
Yeah, thank you so much, Alice. That's a very important question. When a new virus comes, the unknowns are many. So we had a lot of unknowns, and then through time, we started to know more and know more. And even now, we know more, but not really, we don't have complete understanding of the virus. So we still have areas that we should continue to learn about the virus. Then going to the first issue about human-to-human transmission, the guidance we sent to countries in early January was actually to take care of this virus, because we said it's highly likely that there could be human-to-human transmission. And the guidance to countries was very clear. And then one of the global attention was actually on January 14, when we posted the report we got from China saying, what they said, which is they haven't still found human-to-human transmission. And what we normally do is, when we get a report from member states, not only China, but from any country, it could be from US or from South Africa or from Finland, we post their report as is, and this is normal practice. But at the same time, January 14, the colleague you mentioned, Maria Van Kerkhove, the lead on COVID, said that there is, likely of human-to-human transmission, the same day. And that news was carried actually by Reuters. You can check it for yourself. So WHO's position from the start has been that there is a likelihood of human-to-human transmission, and we have been saying it. And that was what we said specifically, including on January 14. And by January 19, China confirmed, and that was then again transferred as reported by China, which is a normal practice, again, like what we treat other countries. So that's it. And then on masks, I think my colleagues have said that, have already explained what the issue was. Wearing closed masks was not a problem even for WHO, even from the start. What we were saying was there was a shortage of masks that our health workers can use. And we were really concerned. So we said priority should be given to health workers, especially with regard to medical masks. That was the issue. But for closed masks, even from the start, whoever wanted to wear was not a problem. And we developed even guidelines to help on that. On asymptomatic symptoms, as you said, my colleagues have already explained what they said, but at that time, she was describing a finding of published articles, not generalizing it. But as you know, when media reports it, take the headline, the tagline, and without the perspective, and that could, have a different message. And that's why we say to our media colleagues, please be, careful when you pick a headline that may give a different meaning to the public. But having said this, there could be things that we could say because of lack of understanding or knowledge, because it was a new virus and we have been learning. So it happens. And the most important thing is, do we know what we don't know? If we don't know, we say we don't know. Then when we know, then we know, we add that into our knowledge and address that, and we continue to fully understand the virus. But it's a normal process actually to start from less knowledge into understanding of the virus, and anything can happen during that process.
Part of this fed into now the U.S. reaction and the U.S. sort of tension with the WHO. So I'd love to get your perspective on your first reaction when you heard that the U.S. was withholding its support to the WHO. Have you reached out to President Trump to try to speak to him about hopefully changing his mind?
My first reaction was, to be honest, I didn't believe it. And the reason for that is, even I now believe that the US administration doesn't have any good reason to withdraw from WHO. And that's my position, strong position, no good reason. And the other thing I would like to underline is withdrawing from WHO actually hurts the US too, because being part of WHO is not just to help those who need support. The US also benefits from being a member of WHO. So it's in its own interest to be a member of WHO, not just to support others. The US people really benefit from being a member. But having said that, I also recognize the generosity of the US, because I was a minister in Ethiopia, health minister. And when HIV was raging throughout the world, and especially in our continent, in my continent in Africa, and when President Bush started PEPFAR, and how that gave hope to individuals, families, and nations. If you remember, during the climax of the HIV pandemic, there was despair, individual, family, at national level. People were dying. And the intervention from the US, from President Bush, changed that and brought hope into individuals, families, and nations. And that's why I believe, especially during this pandemic, working together and the US support is very important. But at the same time, the US also supports by supporting others. So I was really couldn't believe that they decided to leave. Actually, I had a very good discussion on March 23. And he called me, very cordial discussion. We discussed on issues. We agreed on issues we agree. We disagreed on issues we didn't agree. There was very cordial, good environment, good discussion. I really appreciate him for that, but I don't understand what happened after March 23.
Could you share with us what some of the points of tension were, as you said, where you agreed to disagree?
No, there was no tension, but we always discuss on issues, and we have bilateral discussions with member states, and then we don't agree on everything. It's normal. And he was very cordial. I really enjoyed even our discussion because it was engaging, and I thought it was a very good discussion, actually.
And there were no hints at that point that the US support would be withheld.
No, no hint, because it was a very good discussion, and no hint.
And what has been the impact of that? Can you tell us a little bit about, as you mentioned, you know, the US support during the HIV pandemic through PEPFAR has been dramatic. What has been the consequence of the US withholding its funding? Like, how does that affect decisions you're making or resources that you have there at the WHO?
We still don't know the impact of the withdrawal. But again, I don't see the US membership or the relationship with the US as a financial transaction. It's not the money which matters. It's actually the global leadership of the US. It's the relationship with us. And one of the impacts which may be visible is, the global solidarity is weak. Major global powers are not working together. And when the world is not working together and there is a crack, division between them, the virus gets advantage. And that's why from day one, we have been saying, please, you need national unity and global solidarity. And we said to the world, please avoid to use COVID for national politics. Otherwise, the consequences will be dire. And we called on political parties and others to actually unite on the fight against the pandemic, and that we needed national unity. And I know some countries have even formed a committee of the ruling and the opposition party to fight the pandemic together, because they said they had enough other issues to make political or to have political scores, but COVID should not be one of them. And I can give you an example, like Finland, for instance. I spoke with the Prime Minister of Finland, and she was telling me what they did. They have a coalition of the ruling and the opposition party, and they have a common plan, and they fight pandemic together. So that model was what we proposed. So there is problem at national level, lack of national unity, and then global level is influenced by the national politics. So global solidarity also lacking, and the cracks are there, and the virus is still exploiting us.
And as you just noted, in your position, you're often navigating the politics as well as the public health and the science. And you've received some criticism for your comments about China's response and holding them up as a model for how they handled their cases, especially early on. But there are also reports that the government there suppressed, reports of early infections and allowed the virus to spread when it could have been contained better. What's your reaction to that criticism, and did it surprise you?
For criticism, if it's genuine, I wouldn't mind. I don't want to wait even until people tell me when we fail or when we screw up. But politicized criticism doesn't help. I will give you one example or two examples. For instance, about China hiding something. I'm being honest, I don't know. WHO doesn't know if China actually did hide something. We don't know. What we got is the report on December 31st. And even I challenged some people who were saying, okay, China was hiding something. I said, okay, give us the information. If you had information before December 31, give us. By the way, based on the international health regulation, if any member state knew about a situation in China, they could have shared it with us. They're actually obliged to share. But no institution, no country had given us any information before China gave us. So we cannot say China was hiding. We cannot. But, you know, we're trying to learn lessons from what happened. If there is any new information which is coming, we will see. We will learn from it. Then on the other issue on praising China, of course, I did praise China, and I stand by it. For the early interventions, it was very strong. And they shared the antigen map quickly, the diagnosis of the virus, and the sequence on January 11. And we were able to develop the protocol, the test kit, and then to share it with the test kit, to share it with countries who may not afford in the early days. And the speed with which the new virus was identified and the speed with which the sequence was finalized and the test kit was finalized is a record, actually. And any scientist can tell you that. Even people started developing vaccines 8 weeks. The first trial started 8 weeks from January 11, the sequencing of the virus itself. That speed really was something that we appreciated. It's tailored. And where the appreciation or recognition is due, you give it, no problem. So that's what we did. And many countries, by the way, appreciated China. So it was not wrong. It was tailored appreciation.
Looking back, could you identify some things you would have done differently in the WHO's pandemic response, decisions you would have made differently if you had the opportunity to do it over?
If we had the opportunity, I think we will learn a lot. But one thing was maybe the speed with which we should have pushed or put pressure on investments in public health. One thing that's very clear now is even the most advanced countries, the most developed countries, they made serious and significant advances in medicine. In public health, they ignored it. And we knew that was a problem. We should have pushed harder. But normally, we focus on low and middle income countries, and especially in high income countries, we normally say, okay, they could be okay. So we normally operate in some countries who need our support rather than paying attention also to even the high income countries. Now they know that their public health system, many countries, is actually weak. So in the last 2-3 years, if we had hammered on really revitalizing, strengthening public health, would have been good, the speed. Otherwise, we had the UHC, Universal Health Coverage Declaration, political declaration last year. We had the Astana Declaration on primary health care last year. And things were coming up together and we were giving it attention, but I think the speed could have been faster. And that's what, but we will learn our lesson, so we will see. The other part could be, which we could have started earlier, is the peer review mechanism. Countries, reviewing about their condition and among each other as a peer. This was proposed actually by the Africa Group. I remember it's Central African Republic and Benin, representing African Group, who proposed this to WHO to have a peer review mechanism so countries can check each other on what the preparedness level looks like. That was also a bit slow. We could have speeded it up, but now we're getting hold of it, and we will push on that. So these are the two, but we will try to explore what we could actually learn even more.
I want to now move on to vaccines, which everyone is eagerly awaiting as a contributor to hopefully getting us to the other side of this pandemic. Can you describe for us what the COVAX facility is and provide a quick update on where it stands?
Yeah, on COVAX, as you know, the ACT Accelerator was launched on the end of April. WHO, Gavi, CEPI, FIND, UNITAID, many partners, World Bank and others. And we're actually satisfied with the speed with which we're moving since then. And we have one coordinated action. We meet every week, by the way, since early April. We meet regularly. And so far, I think we have more than 200 vaccines, but out of which I think there are 30 of them with trials, phase 1, phase 2, phase 3 trials. And there is, from some of the developers, there is a chance to have vaccines by the end of this year or early next year. And the second objective was equitable distribution. The basic principle we're following now is, in terms of distribution of the vaccines, is to give vaccines to some people in all countries, not all people in some countries. For instance, it could be 20 to 30% of population could be covered in each and every country. This will be the senior citizens, older people, or people with underlying health conditions, and our health workers. There should be a political commitment, decision by all leaders to make vaccines global public good and use the formula that WHO is proposing.
And we're not quite there yet, but we're inching toward it. But I'd like to get your...
I think so. We're now aiming 2 billion doses. That's, vaccinating about 1 billion. That's average 20%. But that doesn't mean that will be 20% in each and every country. But at the same time, we're working with the private sector, and would be good to address the supply-demand issue. At the end of the day, the best solution would be to increase the production capacity, and we're working on that too.
And I'd like to ask you now about your personal vision for what a post-COVID-19 world looks like.
Post-19, I think the root causes and the underlying conditions for this pandemic are not just health issues alone. They could be part of it. I think we should look deep and see all the problems our world has, the inequality, the injustice, everything. I don't want to go into details of that. And how we're treating our planet even. Climate change is affecting the world significantly. That has to be taken into consideration. And then, of course, with regard to health, the most important thing is treating health as a fundamental human right issue. Real commitment, not a lip service, real commitment to universal health coverage and primary health care as a foundation, and big investment in public health. There is advancement in medicine and tertiary hospitals, maybe robotic surgeries, but the simple public health solutions are important, especially, as you know, to prevent outbreaks, epidemics, pandemics.
Thank you, Dr. Tedros, for sharing your perspective on what it's like to guide the world through what is really a historic and unprecedented pandemic. And congratulations again on being a TIME 100 honoree.
Thank you, Alice.